Thank you. Good afternoon and warm greetings from Malawi, the warm heart of Africa. And thank you for that introduction. How I wish there was no COVID-19, and would invite you and all of you to come to Malawi and enjoy our lake and enjoy our fish and chambo. Did you know that if you get into Lake Malawi, you can increase your life by 10 years? That is the myth. I would like to begin by acknowledging all that are present here. Of WHO staff, International Bureau of Epilepsy team from different countries, any government officials present, and any media houses linked to our webinar. I want to welcome you and thank you for attending this webinar. A special mention goes to all people with epilepsy present here. I want to agree with our moderator and of course our vice chair that I don't understand why people, prominent people, decision makers with epilepsy come out, because that has an impact on people suffering from epilepsy, because they serve as role models, but for some unknown reason, people don't want to come out. I'm proud to be here today on the launch of the Advocacy Toolkit. Most of the times when we face challenges or problems, we usually leave these to politicians to solve them for us. We expect them to understand us, feel our situation from a distance, and assume that we all will be well. Let me tell you that it can take years before you realize the real change if you take that approach. In my experience as an advocate for women, children, and youth empowerment, I have learned that there has been need for us to stand up and voice out our concern. When I became minister, I now knew exactly what was wanted because of my experience. However, most of the times the politicians or governments have no information on our needs and wants. This, when our advocacy should come in and fill that gap. I'm excited that the Advocacy Toolkit to be launched is one tool that we all need. Personally, I've taken a look at it and noted some gems that can help you. Be creative and let the toolkit be your guide. Coming back to why epilepsy should be on the health agenda, think of this: in the most African countries, the average total number of voters will be around 5 million to 6 million. Of course, we are not talking about small countries like Eswatini, Botswana, or Lesotho. In Africa alone, we have over 10 million people with epilepsy. What does that tell you? It means we are a constituency on our own and we need to be counted. When the politicians are campaigning, take them to task as a group and hold them responsible. We are looking forward to have organized advocacy from village level. You must build your case using persons with epilepsy, like yourselves and those that support you. Guidance in the tools you are developing should help you in using the toolkit once it becomes operational. The toolkit is ours because I remember in October 2020, when I made a call to all member states that we needed them to endorse the World Health Organization Resolution 68.20, people thought it was just a one-off thing. I am passionate about epilepsy as a mother and as a former head of state. I'm glad now that we have the resolution endorsed and a global plan is being developed. I have first-hand experience to know what it means to see someone facing struggle of drugs. When I took over government in Malawi, there was a crisis of drug shortages in our hospitals. We did turn over the situation, and I ensured that my government listed epilepsy drugs as a priority. I not only did that, but a few days in office, I passed the disability bill, which had not seen the light of day for 8 years. As you might know, epilepsy in Malawi is considered a disability, which meant that people with epilepsy would benefit. I'm excited that today we are gathered here to witness the launch of an ambitious project that started in June of 2020. And it draws on existing research and consultation from persons with epilepsy themselves. This is what we want to see, as it provides insights into the daily lives and lived experience of persons with epilepsy themselves. To all persons with epilepsy in Africa, take this as a challenge that you now have a tool to use to advance your agenda. No one, and let me tell you that no one will stand up for you. From my years as an advocate for children, youth, women empowerment, I can tell you that this is the time to increase your volume. Raise your voices. And here is my last tip for you as an advocate. Ensure women and children are included in your work. Talk about employment. Talk about discrimination and stigma. Talk about domestic violence. And talk about data availability. Any case presented becomes powerful if it is accompanied by data. As we all know that epilepsy is a health condition, there's a tendency to focus on health and forget other social and economic areas. I want to restate my area core, that we need more support on epilepsy in Africa. Let us join hands with all stakeholders and soldier on to ensure that epilepsy is a priority in Africa. Let it be known that advocate number one is the person with epilepsy, and then advocate number two is Joyce Banda. For me, I am morally obliged to raise my voice on behalf of those families and individuals suffering and affected by epilepsy. When I was president, I mobilized fellow heads of state and hosted the first ever Heads of State Summit to fight intellectual disability. May I end my speech by making a global appeal once more for me and Malawi or any other country in Africa to host another meeting of leaders, to have a discussion on epilepsy, and to draw an action plan for the next 5 years. Distinguished ladies and gentlemen, my commitment and passion for matters of disability is well known, not only in Malawi, but on the continent of Africa. It is not fair that we can call ourselves leaders and advocates when we leave a whole generation of people with epilepsy behind. I said this when I launched the fight against intellectual disability. And I said this when I took the matter to Parliament to pass the law. Immediately I became president on matters of disability in my country. And I say this again today. There's work to be done. And I want to promise all of you that it is my intention to work on matters of disability until the job is done. Thank you.